Hey everyone! I'm just gonna invite Dr. Chapter. Just sent the invitation. Really excited to talk to you all about hair today. I've gotten so many questions. Hi Amelia!
Hi!
Thank you for joining me today. I'm just gonna turn up my volume
Thank
here.
you for having me. Can you hear me? Is my volume good?
Yes,
Okay,
I
good.
can hear. Can you hear me?
Yep, perfect.
Awesome. Maybe we'll just give it a minute
Yeah,
while
let's
people are trickling in. I was thinking that in the very beginning, maybe you could do a quick intro about yourself,
Yep.
just to briefly introduce how we know each other. So
Yeah.
Amelia and I were co-residents together at NYU. We both did our
Yep.
dermatology training there. Amelia was a third year when I was a first year resident, and she taught me so much. She's a hair expert, and I'm really, really excited to have her talk to all of you guys and teach me too about hair. So Amelia, do you want to give a little intro about yourself, including
Yeah.
what you're up to now?
So as you mentioned, we went to residency together at NYU. After that, I actually did an advanced cosmetic fellowship in Los Angeles and ran one of the largest clinical studies studying platelet-rich plasma, which I know we'll get into. And that's been an area of a lot of my research for, in particular, for hair loss, how to use the body's natural ability to heal itself in order to grow hair. I was the lead editor on a textbook on the topic. And now I am the director of dermatology at Aesthetics, which is a blended board certified plastic surgeon dermatology practice based here in Silicon Valley. And so we do a lot of hair loss. We do the whole gamut, everything from non-surgical to surgical procedures. And I'm really excited to be here with you.
Awesome. Thank you so much for that great introduction.
Yeah.
So I think, it's been a couple of minutes, so maybe we can get started. And I know in the very beginning, we just wanted to do a basic overview of the hair cycle. And then after that, we'll delve into telogen effluvium, especially related to stress and postpartum, in the postpartum period. I had put up a story asking my followers for questions, and I would say about 75% of the questions were about postpartum hair loss. I think just given the fact that, I recently went through it, a lot of my followers recently went through it too.
Oh, yeah.
A lot of questions about that, questions about conditioner, shampoo, supplements, and then maybe we'll transition to talking about female and male pattern hair loss, of course, discussing PRP, potential treatments, and then, see where the discussion takes us. So do you want to start off talking a little bit about the hair cycle in general, and kind of hair loss in general?
So I think what people don't know is as dermatologists, we're not only skin experts, but we also spend a lot of time studying and learning about hair, the hair cycle, as well as nails. And so those all fall under dermatology. And normally when we think about hair, about 85 to 90% of our scalp is in what we call anagen phase. And that's the growth period of your hair. So that is when you have those nice, robust hairs. When you're pregnant, that actually increases. That's why you have those like really luscious locks that you wish that was like the hair you were meant to have, right?
Right.
And I'm sure you know this very well.
That's why it's even more shocking when it all falls out.
Yeah, and then all it goes away. You're like, what's happening? And then about 10% of our hair is in what we call telogen phase. And telogen phase is the resting phase. So that's where the actual follicle is not producing an active hair. Telogen effluvium, which we'll get into, is when there's a shift in those percentages and those numbers, and that's why you see all of that massive shedding. And so normally our hairs are going through this cycle over and over again. They grow for anywhere between 2 to 6 years. Then for a number of months, they rest, and then they go back into a growth phase. And they're doing them at staggered periods. So you lose about 100 hairs a day because some of those hairs are shedding, and the rest of them are growing. with certain conditions, things happen all together, and it's very distressing, and you see a lot of changes there.
Absolutely, absolutely. And, you know, being dermatologists, we see a whole variety of different types of hair loss.
Yeah.
You know, we're not really going to focus so much on the category of hair loss called scarring hair loss today,
Right.
but do you want to briefly mention the two different buckets
Yeah.
of the scarring versus non-scarring? And this is also just a plug to say that, you know, if you are experiencing hair loss, you should definitely see a dermatologist,
100%.
because a dermatologist will be able to tell which of these buckets you fit into and thus tailor your treatment better.
Right. I couldn't agree with you more. That's like exactly what I would say. So generally there's like these two classes or two buckets of hair loss. There's non-scarring hair loss, which means that you have the potential to regrow those hairs. And most of the things that are common, so telogen effluvium, which is the second most common type of hair loss, male and female pattern hair loss, which is the #1 type of hair loss, those are all non-scarring. And then there's another class which tends to be much less common, and that's where the hair follicle is replaced with a scar. So the potential for regrowth is a lot lower, it's a lot harder, and those are more difficult conversations and management. But you do want to see a board certified dermatologist, because they can help you figure out which of those two categories you fall into, and the treatments for them can be wildly different. So it's really helpful to know exactly what course to follow. I think it's really interesting that there is a $3 billion industry for hair loss products out there, and almost the majority of them, like 90%, more than 90%, have zero science to support them.
Is insane. It's not
regulated. No, it's totally mind-boggling, right? Most of them are over the counter. You walk into the drugstore, it's really overwhelming because you see all of these different products and you don't know what works and what doesn't work. And when we get into supplements, I think that's one of the things that we really talk about there. And so knowing that you're with an expert who can kind of direct you and guide you in the right path is really important.
Definitely. I'm really excited to hear from you about the supplement section too. You know, there's so much misinformation on social media, and I constantly see celebrities advertising these hair gummy bear vitamins, and I don't even really know what's in them, but you know, I think it's best to hear from a hair expert. So I'm really excited for when we talk about that section. So maybe just to kick it off, talking about and delving into telogen effluvium, which we got so many questions about. You know, what is telogen effluvium, and what are some common situations that we tend to see this happen?
Yeah. So telogen effluvium is where that normal ratio of hair, you know, the growing hairs to the resting hairs, actually kind of flip-flops. So all of a sudden your body goes through a major stressor, and we can talk about some of those in specific in a minute. Your body goes through a big stressor, and because it's trying to provide nutrients to your brain and your heart and all of your vital organs, it says, well, I don't need to pay attention to your hair. And a lot of your hairs go into a resting phase all at the same time. You get massive shedding. It's unbelievably distressing. They've done these studies where they look at like the psychological impact of this type of hair loss. And it's really, really upsetting to see so much hair shedding at one time. So telogen effluvium is actually where you get this like en masse migration into the telogen phase. And that typically starts about, you know, weeks to months. So usually 2 months or so, 2 months, 3 months after you've had some type of stressor to your system. And it can last for up to 6 months. And then you start to regrow those hairs. So let's talk a little bit about some of the stressors that can cause telogen effluvium, because I think that's like everybody's #1 question.
Definitely.
And the one
I can share a little about my own personal experience going through
exactly.
Well.
I mean, the #1, the one that most people know about, right, is the postpartum after you've delivered a baby, a couple months after, right? You're just getting used to a new schedule. You're just learning how to like sleep train, and then all of a sudden you start losing all of your hair, right? It's really upsetting. And that's because the major flux in your hormones, and hormones can do this, all different types of hormones, thyroid hormones, they can all trigger this type of hair loss. So that's one major cause of telogen effluvium. I know you can speak to that. You posted that video.
Me, it was interesting. I knew it was coming, right? Because I've studied it. I've seen lots of patients with it. Mine, interestingly, I didn't notice it until about, I want to say 5 months after childbirth.
Yeah.
And I noticed it most in the shower, obviously, because that's when you're really kind of massaging the scalp, manipulating the hairs. And I've always lost a lot of hairs when I shower, but now it's like massive loss of hairs. And when I'm like drying my hair, when I get out of the shower, the floor just looks like a graveyard of hairs. It's just covered. And then as I comb my hair, my brush is just like filled with hairs. And I remember, Amelia, when we were both at NYU, one of our attendings, he's a hair expert. His name is Dr. Shapiro.
Yep.
He always made this comment to patients, and I never understood it. He would say, tell me about your hair shedding. Are you noticing hair shedding everywhere? Like, are you finding it in your food? Are you finding that you leave puddles of hair when you sit? And I was like, that doesn't make any sense. But now that I'm going through it, I understand what he's talking about. Like, as I eat my food, I just find hairs drifting around in my plate, and it's just insane. So it's definitely noticeable for sure.
Yeah. So I asked those exact same questions. A lot of times people talk about the amount of hair they lose in the shower, and sometimes that's variable. And if they can tell me there's like, I normally lose a lot of hair, but this is so much more, that's a good indicator, right? Yeah. The fact that it's all on the floor when you're blow drying your hair at a much higher density than it normally would be. But what I ask people is like, have you noticed it on the counter? When you wake up in the morning, are there hairs on your pillow? Because those are really true indicators that you're shedding in a when you're not putting any stress on your hair, right? You're not brushing it and pulling it. You're not in there scrubbing. So you're not doing anything that would otherwise stress your hair, and they're still falling out.
Right. Yeah. I think one question that a lot of us want to know is, how long is this going to last? And from my understanding, it could be variable depending on the person.
It definitely can be. It typically doesn't last, for most people, it typically doesn't last more than 6 months. It kind of peters off toward the end of that period of time. And then over the next 6 months, that's when you kind of recover and you get back to your normal hair density. So I tell people to expect in a year from now, your hair will be back to what it normally would be. That seems like a really long time to people. I get that. But hair growth is really slow. And if you go back and think about those cycles, telogen phase lasting between 2 to 6 months, it makes sense why it takes about 6 months to stop and then another, 6 months to regrow the hair that you lost. And you get that nice little fuzzy comb as it's regrowing.
Yes. Friends are going through it right now. Like I could see when
you're like trying to figure out which way to part your hair.
Yeah. Yes, it's very cute. But I tell my patients when I see that fringe, I'm like, this is a great sign.
This is a great, exactly. You are going in the right direction. Exactly. Just work with it. Run with it. Yeah.
Be a little patient. And then, Amelia, what do you typically tell patients to do for telogen effluvium?
So telogen effluvium, So telogen effluvium is difficult to treat. So the first thing I really reiterate is like, you've got to hang in there. This is something that is not going to last forever. Your hair will usually return to normal. There are very, very rare circumstances that people debate whether it truly exists or not, where it doesn't. but for almost everyone, it will return to what it was. And then there are things that we can try to do to aid that along. So one of the things that has been talked about in Telogen Effluvium is using Rogaine. So the generic name is Minoxidil. You don't have to buy Rogaine name brand. Minoxidil 5% is now FDA approved in men and women. It's actually, there was a publication that was put out by the Pediatrician Society that said it is not safe to use in pregnancy, which you wouldn't need anyway because you have the most amazing hair you've ever had. But it is safe to use in breastfeeding. I still recommend that everybody run it by their pediatrician. Mm-hmm. But what minoxidil does is it's very complicated. It's a medication that started off as a blood pressure medication, and then they realized that people's hair grew amazing while they were on it. And then in the 90s, they made it into a topical that got FDA approved. And for now, 20 years, we've still been trying to figure out exactly how it works. But in general, I know it's like, well, a lot of the medications in dermatology are like discovered because they worked really well in another condition.
Right, and, like Latisse, right?
Right, so that's the exact same. So that's the other hair thing that comes up, right? Latisse was initially used as an eye drop for glaucoma patients that all grew these like amazing thick horse eyelashes, and so they made it into a topical.
Right.
So minoxidil, what we know is that it actually gets your hairs to transition from that telogen phase faster into an anagen phase and stay in an anagen phase for longer. So for someone who is in this massive amount of telogen shedding, if you can kind of accelerate that process, that is one way to help try and combat telogen effluvium.
Yeah, that's a great tip. And, you know, I feel like for every medication, there's a risk. You weigh the risks and the benefits, right? And when we're talking about potential risks of minoxidil, as far as I've seen in my practice, they're quite rare. Some people can experience some burning or a little bit of an allergic reaction when they first start it. Some people can experience a little bit of extra
hair
in other parts of their body. But overall, it's very well tolerated.
It is.
And then the other thing that I got a question about was, and this is a common myth about minoxidil, is that once you start it, you have to be on it for life. I think that's a complex question, but what I say to patients is it's like any other medication. It only works as long as you're on it, right? Like if you're taking a blood pressure medication, it will work as long as you're on the blood pressure medication. So if you decide to stop the minoxidil at any point, and correct me if this is wrong, then the hair that it was helping you to hold on to can then naturally be shed, you know, along with their natural cycle.
Right. So you'll basically go back to what you were before. It doesn't mean it's going to accelerate your hair loss or you're going to be in a worse place, but you'll go back, you'll revert back to the pre-minoxidil kind of hair that you had. Now, if you're talking about postpartum, you may be using it for a year and then your hair is already kind of, you know, in Telogen Effluvium, your hair is recycled to what it used to be, and then you can kind of taper off of it and you won't have that same reversion, massive shedding that you otherwise would. So in that instance, I think it's a little bit unique. You know, if you're talking about male and female pattern hair loss, it's a little bit different story.
Right. So that's Rogaine. And then in terms of other tips for Telogen Effluvium, I've heard of, you know, diet. So just making sure you're eating a healthy, well-balanced diet with protein and iron. And any other tips? Maybe we can talk a little bit about supplements too.
So diet is important, particularly proteins. There are certain amino acids to certain components of the proteins that they have shown to be more helpful in building robust hairs. The other thing is to, and your dermatologist can check, they often will check some basic labs, looking for any vitamin deficiencies. So sometimes people, especially women, if they have heavy cycles, if they're breastfeeding, and losing nutrients to another little human being, their iron will be low. That can contribute to thinning of hair and telogen effluvium. So looking for any of those nutrient deficiencies, I think, is really important. And then there are supplements out there, and there are a lot of supplements. Biotin is the one that people think of most commonly. And biotin is basically a myth. There are no scientific studies that support its use in general hair loss. If you're somebody who happens to be deficient in biotin, and you would know it because you would have a whole bunch of other symptoms, not just hair loss, then it can be helpful. But for the general public, I actually don't recommend taking biotin, especially at high doses, because there are new studies now that suggest it alters other lab tests, particularly ones that have to do with looking for heart attack and cardiac monitoring. So that's something you want to be really careful with. Thyroid. So things that would be important not to miss, it can interfere with those tests. And if you are on biotin, you want to let your other providers know that you're taking that supplement. So when they ask about medications, don't just tell them your prescription medications, but also tell them the vitamins you're taking, whether they're hair vitamins or others, because they might want to take that into account when they're interpreting your labs.
That's a great point. You know, I think biotin is one of those things that we are taught, you know, it might work, it might not, but like a lot of other things in hair, in the field of hair loss, there's no scientific backing to it. And in this case, it could even hurt potentially because it changes your test results for your other conditions. So if biotin's off the table, then what are some options that patients can look to for hair loss?
So the two most well-vetted, medical grade, they have scientific studies to support their use in hair loss, are Nutrafol and Viviscal Pro. So Viviscal Professional. And I'll go over the second one and the distinctions in a minute. So both of these are center around C protein. So they actually are working to, augment the protein in your diet, and they use different forms of kind of marine complexes in order to do that. Nutrafol also has several adaptogens, so they kind of try and decrease the stress levels in your body, the cortisol levels, so ashwagandha is one of them. It has the active ingredient in turmeric, and whether you're a man or a woman, it'll have different amounts of something called saw palmetto. The problem with, and from my perspective, it works and people really like it. And I know there are a number of dermatologists that recommend Nutrafol. The problem with it for me is that I don't have a background in Eastern medicine. And so it's hard for me to counsel people on some of the potential drug interactions of some of the homeopathic components, whether that will interfere with their cardiac medications or their thyroid hormones. And so it's a little bit more complicated because there are more ingredients in Nutrafol.
Got it. And Nutrafol and Viviscal Pro are medications that you would be on long term as well. Is that correct?
Yeah. So
you don't have potential interaction.
So typically, I mean, the way they've been studied is, and the way that most things are studied is in male and female pattern hair loss, because they are the, by and large, most common type of hair loss. There are, it's probably over 50% of men suffer from some form of male pattern hair loss. and a quarter, and then that percentage goes up after menopause of women. So most of these things have been studied in that context when you would be taking it long term. For somebody with telogen effluvium who's thinking of using a supplement as a bridge to when they have kind of more robust hair, may be able to take it for a shorter period of time. They're just trying to do everything they can to help support those new hairs that are growing in and pushing out the telogen hairs.
Got it. That makes sense.
Yeah.
Yeah.
So the other one, and the one that actually we carry in our office, and in kind of in honor of this little chat, I put up a giveaway on our on my Instagram, so you can win a month's supply of Viviscal Professional if you go like the post and follow the instructions on my account. But Viviscal Pro is what we carry in our office. It again is based on a C protein complex, but it has fewer ingredients. It doesn't have some of the same adaptogens, and it doesn't have saw palmetto in it. So it's a little bit cleaner in terms of its ingredients. So I feel more confident in that way counseling people on taking that medication. The difference, the one thing I was going to say, and I don't mean to cut you off, is Viviscal is also available if you walk into Walgreens and CVS, but that is not the professional version.
What's the difference?
So yeah, it's a good question. So the professional version has twice the amount of active ingredient as the over-the-counter version. The professional version is only sold through doctor's offices. And it's about $10 more. So I tell people, like, why would you want 50% less of the ingredient you know is helping you and spend about the same amount of money? So I always recommend the Viviscal Professional, and it is the one that all of the clinical studies have been done with.
That's wonderful. I learned something new today as well.
Yeah.
I didn't know that there was a difference between the professional and the ones you can get.
Well, so interesting story. I was like kind of not a believer in all this stuff, and I'm really skeptical of supplements in general because the FDA doesn't regulate them like they do medications, right? So they don't have to go through the same rigorous process. And so when I was in residency, I tried the I was like, how do I know? I tried the Viviscal from Walgreens, and I didn't see like any. I took it for probably 6 months. And with most of these things, you need to take them for 3 to 6 months before you see a meaningful difference. So I took it for probably about 6 months, and I saw nothing. And I was like, I'm not spending this amount of money on a monthly basis to see no changes. So then when I got into fellowship, I decided, okay, I'm going to see what the professional does. Maybe there's a difference here. So I started taking the professional, and my hair was growing so fast, like I couldn't keep it under control. Wow. There's like pictures where it's like, it's almost down, like it's down to my upper waist. I was like, and all of a sudden I was like, okay, so something is clearly different between these two formulations. And it is working. And I've had people come in and ask me, like, is it normal that my my leg hair is supposed to grow more also while I'm on the supplements, or that I feel like I have more eyebrows or more lashes? So it does work on a systemic effect.
Oh, so interesting.
Yeah.
Huh. I didn't know that.
Yeah.
Wow. And I think Lindsay is asking a question here. Do you trust purchasing Viviscal from Derm Store or similar online derm stores?
So you definitely want the professional. My understanding is a professional is really only allowed to be sold through physicians' offices. I don't know specifically about Derm Store, but I do know that on like Amazon and those types of places, there have been a lot of like counterfeit and or expired or other things that have been put up on Amazon. So I generally don't recommend not getting it through a like licensed provider.
That makes sense. That makes sense.
Yeah.
Another question we had was, is there any benefit to taking these supplements like Nutrafol or Viviscal Pro proactively or preemptively? Like if you give birth and you know that the telogen effluvium is coming, should you start taking these supplements?
So it really, they're not really meant to counteract the hormonal flux that you're going to get. So you're probably still going to go into telogen effluvium. And in general, I just don't recommend taking supplements that aren't regulated, especially supplements that may impact hormonal cycles while you're pregnant. So I generally just say don't do it. Um, you know, wait until you've delivered and we think it's safer, and run it by your pediatrician, your OB. Just at least have that conversation with them. Make sure that they're okay with it. I always counsel people that they should do that.
Right. Yeah, that's a good point.
Yeah,
Everyone's situation is different, right? For all of you
it
guys,
is.
you might have a different underlying health condition. Your hair condition might be different.
Right.
So it's very important to see a dermatologist to distinguish between the types and also to come up with a treatment plan for you.
And the other thing to note is in both of these supplements, they do have biotin in them.
Okay.
Even though we've talked now about not taking biotin, and I wish they could pull it out of them, there are a couple supplements that are being developed and vetted now that are going to be biotin free. So those will be coming in the pipeline soon.
Okay, great.
Yeah.
Another question I got asked a lot was shampoo and conditioner recommendations. One question was, do I even need to use shampoo? Another one was specific product recommendations. And then the third was like if you're doing certain hairstyles, like doing a lot of straightening or straight perming, or using hot curling irons, things like that. Do
Okay.
any of those impact telogen effluvium?
Okay. So in general, the types of shampoo that you use, other than minoxidil, which isn't a shampoo, it's a post, you know, post showering treatment. And as a woman, you only need to use it once a day. It'll say twice a day on the bottle, but I recommend women only use it once a day. It's a lot easier to manage with long hair, first of all. But the types of shampoo generally don't make a huge difference in terms of impacting telogen effluvium. Doing a lot of styling, so a lot of heat on your hair, a lot of tension, that can just accelerate the amount of hair loss you're seeing, and can damage the hairs that are growing back in. So I try and have people monitor the amount of heat and overstyling that they're using. And if they are doing that, definitely use a heat protectant before. And there are a number of brands, you know, Dry Bar makes a heat protectant, Orbe makes a heat protectant. You just want some product that is actually minimizing the damage to your hair. And then to try and do it as few times a week as possible. Those are the biggest things, specifically in telogen effluvium. We can talk about some other just general recommendations for shampoos in a minute. Yeah,
that would be great, actually, if you want to talk about general recommendations for shampoo, because
so,
that was a super popular question.
The one other thing I wanted to mention, so besides postpartum telogen effluvium, any major stress to the body, so any surgeries, illnesses, and I think this is something that we're going to be seeing a lot more of in the next coming months, because people have been under so much stress. There's been this, my dad's is a psychologist and a psychotherapist, and he calls it global global anxiety. There's been this high level of anxiety and stress, and when you're under a lot of psychological duress, you can actually precipitate telogen effluvium. So I think in this kind of coronavirus mass unknown, we may see more of this shedding in the future, and so that's something to look out for, and not be completely caught off guard. Know that it might be something that's coming down the pipeline.
I think so, yeah, which is why I think this live is very timely.
Yeah,
Um,
so do
you
I.
know, that we can give proper information out there, and people will know what to expect and hopefully understand that this is a self-limited process.
Right, exactly, and
Um,
not be too frightened by it because it
right.
can be really scary.
Definitely. Yeah, I think for me personally, why I haven't been too stressed out about my hair loss is because I actually had a lot of hair to begin with, so
Yeah,
it's a little more manageable
yeah,
now
yeah,
after
yeah,
the
yeah.
telogen effluvium, but also because from my dermatology background, I do know that this is self-limited. So
Right.
even though I'm like, oh my goodness, there's so many hairs on the floor, I know it's not going to last forever. I know it's temporary. So I think knowledge, having that knowledge is a type of reassurance.
Yeah, it's very empowering and allows you to kind of self-soothe and to be like, okay, I can live with this
Right,
for a period of time, and then we can move forward.
right, right. Um, Going back to the products for a
Yeah,
moment, shampoo and conditioner recommendations, and also thoughts on dry shampoo as well.
yeah. So shampoo and conditioner recommendations are really difficult because there's so many types of hair, right? There's
Right.
hair that is, I mean, straight, and I have like a lot of really fine hair, and it's very
Mhm.
straight. And then there, on the other end of the spectrum, there is very kinky, coarse hair where you could almost not even reach the scalp, right, when you're trying to wash and shampoo it. And so making blanket recommendations are
Right,
really difficult, right?
right.
So I think you have to try and figure out, um, you know, is your hair really dry? Is it, and if it is, you want something that's going to have emollients in it, shea butter, coconut oil, coconut oil, things that are going to help um, give it more moisture, that are going to really instill that into, so the outer part of the hair is called the cuticle, that they're going to really instill that into the cuticle. And I generally recommend that you do a mask like once a week in most cases. And then if you're somebody that has really kinky, coarse hair, you can often get away with not washing your hair once a week, once every 2 weeks, because you don't build up as much oil and debris as quickly because of the texture of your hair.
Hmm.
I definitely recommend that you do use a shampoo because, um, water itself, though good at cleaning off some of the oils on the shafts of your hair, it doesn't get any buildup that can occur on the scalp. And a lot of that is just, we shed skin all over our body. The scalp is the same thing. So if you don't get some of that extra debris off, it actually encourages you to make more oil. And so you get into this kind of vicious cycle of overproduction of oil and it getting caked on. And then you have a little bit of a sticky situation.
Right.
So I definitely recommend using a shampoo. I do recommend using a conditioner to help give your hair more, especially at the ends. I don't always recommend that you do it all over, right? Because the oil is produced at your
Yeah.
scalp and then it kind of permeates down. So at the ends where we know we get a lot of breakage, they're much more friable, they tend to be dry. That's where you use your conditioner.
Hmm.
And what I do is I put it on and then I like shave and wash my face and do all my other stuff. And then so that it can sit on there for a couple of minutes and then
Yeah.
wash it off. Um, there is a brand of shampoo that I started playing with recently because I was really intrigued by some of the science behind it. It's actually available at Sephora. It's called Olaplex.
Oh, I've
Um,
heard.
yeah.
Yeah. What
So
about that?
it was developed by these chemists who spent a long time in the lab trying to figure out how to repair the bonds in your hair that are broken by heat and
Hmm.
broken by environmental stresses. And those bonds, the bonds that keep your hair nice and smooth, that prevent it from breakage, are called disulfide bonds.
Yeah.
And so what they did is they spent all of this time trying to figure out a formulation that would repair disulfide bonds. And so now they have a multi-step sequence. There's a shampoo, there's a conditioner, There's like an oil mask if you really want to get involved, just like you would on your face, right? Once a week, you might mask your face. You can do the same for your hair. And so I think that that is one option for people who are especially styling their hair frequently and trying to figure out a way to combat some of the damage.
Okay, that's really interesting to know. So
Yeah.
there is some science behind Olaplex. I'm
Yeah,
curious.
I was
You
like,
tried it?
I'd heard like all about it and I'd seen it, you know, going into Sephora, and I was like, and I'm generally, again, like pretty skeptical of all this stuff. So I like went on and I was like, okay, so they have like a link to their science. And I was like, I'm gonna read about their science and like, what about these? And they got into like the disulfide, and I was like, the more I got into it, the more I was like, okay, this makes some sense. Like, I understand why you would want to do this. From my dermatology background, I understand like the structure of hair and their thought process, and the way that translates into our medical thought process were lining up nicely. So I was like, all right, I'm going to try this and see what it does.
Yeah. What are your thoughts so far?
I actually really like it.
Yeah.
I think it has definitely, so like I get that, you know, like everybody does that with like weird halo baby breakage here. And I feel like it's, I haven't been using it for that long, but as I've been using it, this has grown out more. And my hair grows pretty rapidly, so I can tend to see those changes quickly.
Mm-hmm.
And the one thing that I do think is it's a little heavy. So if you have very fine hair that gets oily very quickly, you may want to alternate it with a lighter shampoo. You know, using it every other time you wash your hair. I wouldn't necessarily maybe use it on a daily basis. I wash my hair 2 to 3 times a week, so I can get away with using it every time.
That's really good to know. I'm really interested in trying it now. You know,
Yeah.
personally, I've always been wondering if there's a difference, like with, you know, skincare products. Is there truly a difference in the shampoo and conditioners that are brand name, super expensive,
Right.
versus like your run-of-the-mill Pantene Pro V, you know, that kind of stuff?
So,
What do you think about that?
I mean, I think yes and no. I think it comes down to some of the ingredients that are in the shampoos themselves. And you can now get drugstore shampoos that have eliminated. So I tend to try and be a little bit more, with the exception of my medical grade skincare, which I'm not giving up, and that's a whole nother talk. But in terms of my like makeup and other products, I tend to try and find things that are a little bit cleaner. So I look for things without parabens and certain ingredients that we think may have harmful effects. Jury's still out on a lot of that, so everybody is kind of made their own decision. But things that we know about the hair is that if you overstrip it, just like you overstrip the skin, it tends to make more oil and more buildup. And there's been a lot of movement to go toward sulfate-free
Yes.
Shampoos, because the sulfates are what give you that really sudsy, like, you know, it feels really great, like all of those commercials, right, where you're like in the shower and it's like foaming everywhere. Well, it also tends to strip all the oil off of your hair. And when you get that really, really squeaky clean hair, it actually sometimes backfires and gives you a more oily hair down the line. So then you have to wash more frequently, use more shampoo, you spend more money, whether it's drugstore or not. So I tend to try and steer clear of some of those more harsh chemicals.
That's good to know. Super interesting to hear your take on clean skincare and clean shampoo and conditioners. I mean, that's like a whole other topic.
That's a whole other topic. And it's not, all I'll say is my medical grade skincare is medical grade skincare. You can't replace that. It just is what it is. But in terms of like makeup and other things, we could do a whole nother discussion on that.
Yeah, I'm realizing as we're talking through this, you know, Emil and I had come up with a whole plan for this hour.
We have planned out that, yeah.
We have so much to talk about. I mean, just within Telogen Effluvium alone, and also I think this is really important discussion that we're having about common myths in hair loss. So I've learned a lot about, you know, the things we've been talking about, like the supplements and different products. I've never had a chance to talk to anyone before about shampoos and conditioners. So this is really great.
There's like nobody talks about it. You just go on your own and you're like, and
right.
you know, on the aisle of,
right.
Even for me, and I, you know, I see a lot of hair loss patients. I do a lot of platelet-rich plasma, which I can talk about really briefly in a minute. But because it kind of ties into this natural supplements, and there may be a role in Telogen Effluvium. But even when I go there, I'm like looking and I'm like, this one might be good. This one seems like an off, right? Like it's very, very difficult. There's zero guidance. And there's new products that come out all the time. Drunk Elephant, which I think is a really great brand. They just released shampoo,
I use
you know.
shampoo.
Yeah, I know. I was like,
so I was like,
maybe that should be something I try, you know, like sometimes it's a little bit of trial and error and seeing what works for your hair type, because hair types are so, so different. Exactly. And then also knowing just that heat styling, whether it's a flat iron, a curling iron, even a blow dryer, those all do damage your hair. So trying to give yourself a break. So like while we've been basically quarantined for a very, very long time, I've tried not to heat style my hair as much, except for today, where I had to get like, I had to get dolled up for this, you know. Like I actually put on a full face of makeup, which I haven't done in however many weeks. Right?
I'm like, this is, you know, I'm taking this seriously.
And no joke. I was like, it's like for telemed, you know, virtual consults and virtual appointments, and that's about it. But I've tried to give myself some breaks from heat styling, just knowing that that does damage your hair in general. Those are the other big tips.
Right. Before we move on to PRP, maybe we can finish up with PRP, but also wanted to know your thoughts on dry shampoo. And then we got a couple questions about ketoconazole Nizoral shampoo.
Yes.
Using it in androgenetic alopecia versus Telogen Effluvium, because I know that the Nizoral shampoo can dry your scalp as well. So if you could touch
dry your scalp.
Two topics.
So, okay, so first starting with dry shampoo. Dry shampoo, I think there's definitely a role for it. It's a nice adjunct. It's nice to be able to get an extra day out of, especially if that means that you're not heat styling your hair for one more day. The problem is using dry shampoo every day. Just, you know, you get this thick layer of extra caked on debris on your scalp, so it can't breathe, it can't shed both hairs but also skin cells in its natural way. So you want to make sure that you're not overdoing it in terms of dry shampoo. And when you do wash your hair, that you really want to get wash into your scalp. So almost do like, you know, a really deep scalp massage treatment to get all of that off, so that you have several days before you reuse your dry shampoo and can let your scalp breathe.
Okay. Any favorite products in terms of dry shampoo? Or are they all kind of
dry shampoo? I've had difficulty with dry shampoo in general, because I feel like you get this like white halo, and I don't want to look like I have I'm graying more than you know, there are now dry shampoos. I think Orbe makes some. Drybar now makes they're tinted, so you can find ones that more match your hair color.
Interesting.
Yeah, so if you're going to use a dry shampoo, I think just in terms of like elegancy of formula and blending in, those would be what you don't want to use. You also want to make sure that you it's hard to do it on Instagram, but that you hold it not like directly on your scalp, so that you get like a fine mist. That will both prevent it from creating like an armor on your scalp, and it will also make it so that it disperses a little bit more evenly, and you have less like clumps of like color in one area or the other.
Yep. Great tips. And then the other question was on Nizoral shampoo.
Yeah. So Nizoral, Telogen Effluvium, I don't tend to use it. androgenetic alopecia. I also don't usually use Nizoral very often. Nizoral, which is ketoconazole, it's, if anybody has ever had a prescription shampoo that's like this red kind of clear and it smells not very good at all, that's what this is. It's actually an antifungal, and the way that it is traditionally used is for something called seborrheic dermatitis, which is the dermatologic lingo for like basically clinical dandruff. And that's where I feel like it has the biggest role, and where I use it. And it is very drying. So when people are using it, I tell them, this is not a shampoo. This is a scalp treatment. You get it into your scalp, you rub it in there, you leave it on for 5 minutes, you wash it off, 5 to 10 minutes, you wash it off, and then I follow it with a normal shampoo and a normal conditioner, because I feel like you can instill more moisture that way.
Mm-hmm. Yeah, I do the same thing. I only use it if a patient has seborrheic dermatitis, which is medical grade dandruff, or, if they actually have evidence of a fungal infection.
Fungal infection, right, exactly.
Some people may say that it can help just with overall anti-inflammatory properties. But because of its severe drying side effects, I tend to not use it that often, unless there's a very specific reason to use it.
And a lot of the other treatments that we typically recommend, Minoxidil, PRP, a number of these other treatments that we're recommending have anti-inflammatory components to them. And so you don't always need an additional step. Just as like a little anecdote, he won't mind that I share this. My husband, when he uses Minoxidil, and when he doesn't use it, one, he sheds like crazy and it drives me nuts. But two, no, it's like super noticeable.
Really? Wow.
He's very, very sensitive to it. But he says he can actually feel the tingling and the change when he's not using it. He says he feels like micro inflammation all over his scalp. So, which tells me that all of the therapies that we're recommending are actually decreasing some immune response in your scalp, and you don't need this additional shampoo to do that.
Gotcha. Okay. That is very interesting. I mean, well, your husband's a very lucky man, because he has a hair expert sitting at home with him who can help him retain his hairs. My husband has like a really thick head of hair, because I joke, we look at his father, my father-in-law, and he has like an Asian afro at the age of 65. Oh no, he's almost 70. At the age of 70 this year, he has like an afro. So I joke that my son is gonna have like
more hair than, he's gonna have like
full head of hair. But anyways, we have about 7 minutes left before we reach the maximum time for this. I think we will have to do another live, because we have so much more to get through. But maybe in the time left, you can very briefly touch on what PRP is and how that could help in telogen effluvium.
Yeah. So PRP, or platelet-rich plasma, is a component of your own blood that's separated out. It actually looks gold. It doesn't have any red blood cells in it. So we call it liquid gold. And it is chock full of the signaling cells, the nutrient cells that can be injected into the scalp and actually counteract some of the signals that the hairs are receiving. So it tells the hairs to go into anagen phase, to stay in anagen phase for a longer period of time, and to do so with building thicker shafts. It also increases the amount of blood flow in the scalp, so you have like a healthier circulation to get nutrients to the hair, and it also decreases inflammation. The way that it's mainly been studied, and this is the area where I do a lot of research, is in male and female pattern hair loss. But there is a huge, and it continues to grow on a daily basis, body of literature that now supports that. It's been adopted by dermatologists, I think largely as one of the options. And it's nice because it's a natural option. It's coming from your own body. So if you're somebody who's not interested in taking oral medications or other things, it's a nice option to have. You know, it's been a little hit or miss in terms of studies with Telogen Effluvium, and there aren't very many published studies that look at that condition, partly because we know it goes away, so there's less incentive to study something that is transient. Right. However, I do know anecdotally that I have a number of colleagues, and I've worked with even some of my own patients who have had like postpartum Telogen Effluvium, and they're like, I'm breastfeeding, I don't want to take anything, but injecting something that came out of my own body that doesn't have any added medications, I feel safe doing. And they all had really like, I have one colleague that I worked very closely with who did one treatment, and she said, I have abs, like no shedding at all. And I know with some of my patients who have had hair loss because of like, extensions and extreme heat damage, over styling, it works really, really well for those patients. So there is some anecdotal evidence. I just don't think we have enough to say that, yes, this is a go-to therapy. This is something I would do routinely. You know, it's not paid for by insurance. So it's something, a discussion that we have on an individual basis usually.
Right. It's an out-of-pocket kind of cosmetic procedure that people can elect to pursue, you know, not covered by insurance. And oftentimes PRP is delivered in conjunction with microneedling or with some procedure that causes controlled damage in the scalp. Do you usually perform PRP with a procedure like that, or have you ever done PRP just on its own?
So on the face and skin, I almost always do it in conjunction with microneedling, and those are for totally different uses. On the scalp, I actually use it on its own, and I have a very unique delivery system. So I inject it at a much deeper level, which incidentally hurts way less. I know that sounds like it would be awful, but it hurts way less, and you can do many fewer injections, and it spreads all over the scalp. So you're getting it into a level where there's this like loose connective tissue, and then it bathes the entire scalp. So you can do many fewer injections that way. And I've even had patients come in who said that they've noticed, because it's bathing and spreading everywhere, they've noticed that their eyebrows have grown because this whole area is actually continuous with one another. And so I generally do not do it with microneedling. I actually find that sometimes the trauma of microneedling itself can cause more shedding if you over damage the scalp. And I find that the injection itself is just, it's kind of like, it's what we call macro needling in my office, aesthetics. We all have this term, we call it macro needling versus micro needling.
Oh, interesting.
My partners and I, and so it's a macro needling technique. So you're already getting some damage. That damage is stimulating a wound healing response, and you just go from there.
Got it. And are you injecting kind of all over the head, or you have certain points that you choose to do it?
So it depends on the pattern of where people are losing their hair. So if you have an area that's like, if you have an area, with the exception of alopecia areata, which is a different topic that we can talk about a whole other day. Yeah. It's like, hair's a lot. With the exception of that, if you have like male pattern hair loss and you have a shiny bald area, you're probably not going to grow there. So I go around those areas, and in areas where the hair, you still have hair, but it's thinner. So let's say you're a woman that comes in with female pattern hair loss that is widening of your part and just, you know, a lot less dense on the top, or you're coming in and you have telogen effluvium, and this means you're kind of shedding all over, but you still have hair everywhere, then I'm just spreading them out about every 2 to 3 centimeters, kind of evenly continuous in those areas where you're having the most thinning.
Got it. That is so helpful. So we have just 30 seconds left on the clock, so just wanted to wrap up. We had such a great discussion today, and I think we have to do another live to get through the rest of our topics.
Love that.
But I learned so much, and I think everyone who joined did as well. So, Amelia, I just want to really thank you for taking time out of your Saturday morning to sit down and chat with us about hair, telogen effluvium products. And everyone, please go follow Amelia at Dr. Hausauer, and we'll see you next time.
Well, thank you so much for having me.